Hi, I'm Mariga from facialreflexology.ie and thank you so much for checking out our Facebook page. If you were here, you obviously have an interest in having facial reflexology treatments or just finding out a little bit more about how they can benefit you. I know that facial reflexology is a new concept to a lot of people. You're going to be so familiar with foot reflexology, but not so many people have heard about facial reflexology. Now, it's not new. It's been around for this system that I use, the Sorensen system, which is one of the most progressive schools of facial reflexology in the world. Been around for about 40 years, and I suppose the similarities to foot reflexology are that we are working different parts and systems and organs of the body through micromaps, but in this instance, rather than on the feet, it is micromaps on your face. The extra layer really for me, working with the Sorensen system neuroreflexology, that neuro part means that there is a whole added aspect. So as well as working on the micromaps for organs and systems and meridians and energy flow, we are also working on physically on nerve endings, and we are relating everything back through all of those systems. But I particularly like the neuro aspect because you can get very quickly into the cause of your problem through the nerve path. That is something as well that I think is important to note in facial reflexology, that we are thinking about causation all the time. So it's used for anything. It's used for physical issues, great results on joint issues, things like that. I always enjoy those because people just get so wowed by it. But I particularly love getting deeper than that and getting into the emotional underlying issues, because so many of the physical things and so much of the stress all comes initially from emotions, from with the stress, from frustration or anger or fear or just fed upness. So getting to where that first started up in the body, as opposed to just treating symptoms, is a much more comprehensive treatment and of course better and longer lasting results. So all of the layers, the emotional, the physical, mental, everything is treated in a fully comprehensive, in a simple, what I call a base treatment, and then your symptoms then are considered in the second phase of the treatment, which is your personalized section. So it is nice to have. Some of the movements and some of the work can be quite deep in areas of the face. Obviously, we want to get in there, but it is very relaxing. Most people fall asleep. Especially the second time. The first time, I know when you have something new, it's unusual, but definitely the second time people are having a very deep relaxation, if not a full sleep. So it's lovely to have. It is very effective, and it's got a nice bonus side effect that it is actually lovely for your skin and your complexion and everything, because we're working all those muscles and systems through the face as well. So that's just a little bit about neurofacial reflexology. And if you have any questions at all, do give me a call. It is my favorite subject to talk about, and I look forward to seeing you for your treatment in my treatment room really soon. Thank you for watching.